In April 2026, the MV Hondius set sail from Ushuaia, Argentina, carrying 147 international passengers on an expedition cruise. But mid-voyage, people started falling terribly ill. What began as fever and fatigue rapidly escalated into internal bleeding and complete respiratory collapse. The physical decline was incredibly fast. 3 passengers, a Dutch couple and a traveler from Germany, died before the ship reached help. When the World Health Organization stepped in, they identified the pathogen. It was a hantavirus. Diagnosing a terrestrial virus on a ship completely isolated deep at sea defies standard epidemiological logic. Humans typically contract hantavirus by breathing in microscopic particles from infected rat or mouse waste. Yet health officials scoured the MV Hondius and found no evidence of a rodent infestation on board. The threat multiplied when authorities realized some potentially exposed passengers had already left the ship early at St. Helena Island. A lethal pathogen was circulating in a closed environment and had already scattered across borders before doctors even knew how it got there. Investigators soon discovered the ship was hit by a specific and rare variant, the Andes strain. While most hantaviruses require a rodent host, the Andes strain is one of the only variants capable of spreading from person to person. The theory suggests a single infected passenger boarded in Argentina and close contact up to 45 days to appear. Tracing an easily transmissible virus with a 6-week delay turned the international health response into a massive race against the clock. On May 10th, Spain allowed the ship to approach the Canary Islands under strict international health control. Medical teams in hazmat suits separated passengers into small groups, moving them through isolated corridors directly into waiting transport vehicles. Specialized quarantine flights then dispersed the evacuated travelers to isolated medical facilities across the UK, the United States, and other nations. This synchronized response demonstrated how multiple countries can activate a total biological lockdown when a major threat emerges. In Tenerife, the ship's arrival sparked intense local panic. Residents, still traumatized by the early days of COVID-19, demanded complete transparency. This side-by-side visualization compares the wide-radius airborne spread of COVID-19 against the slower mechanics of the Andes strain. Looking closely at the Andes data, it requires intense, sustained physical proximity to infect a new host, making widespread community transmission very difficult. Understanding those mechanical limits shows exactly why health agencies consider the risk of a global pandemic to be incredibly low. For the 147 people aboard the MV Hondius, the outbreak took a severe localized toll, resulting in 3 deaths and roughly 8 severe infections. But outside the ship, the global health net functioned exactly as designed. Doctors deployed rapid genomic identification, aggressive international contact tracing, and strict isolation protocols. While nature will always produce biological anomalies, this coordinated response demonstrates that a localized outbreak can be identified and halted before it spreads into the general population.
Subscribe to my YouTube channel. Thanks.